I think
Maybe
it'd
Menzies.
be wonderful to see from the mind mapping and the quite targeted suggestions that have been put forward at today's workshop, that they can be carried forward. There are chronic disease prevention and management sort of task force and groupings that the department is bringing together again and re-energising, that will bring together people from across the sector. And wouldn't it be wonderful if we could take a really focused set of recommendations from this summit that I think people have pressed for prevention, but I think it would have to cover prevention all the way through to treatment. And not only did we hear some great ideas about addressing food insecurity, about addressing some critical issues around housing and working with education to enable young kids to do things that will keep them healthy for their life. But we heard great ideas about what we can do in primary care, about very low calorie diets, about new types of treatment that might have massive impact, that the opportunity is for us to say, we think this will have an impact, let's implement it, evaluate it, and show that it's achieving what we want. And I think we can come together to do that. Yeah.
I also think there's a tension we have to work through between dealing with this as a crisis and then neglecting something else and then dealing with it as a crisis. So the additional crisis on top of what we already had with diabetes was COVID. And COVID has set all our chronic disease management way behind, and we now don't have any workforce to meet that need. So whilst we could channel a huge amount of resources into diabetes, we'll then be doing it to renal, and then we'll be doing it to something else. So I think there's this real tension between let's get on and use this information just for diabetes and get going, and the idea of actually what is the baseline that we could do across all of chronic disease, and how quickly could we get that moving as we move towards the longer term investment in primary care?
I suppose the benefit and what gives me hope, noting your concern, though, is that a lot of the ideas that were talked about were primary care focused and were thinking about ways to make sustainable change. And some of those interventions would address the risk of diabetes, kidney disease, vascular disease, all of it together. So I think we can come up with a shared agenda that addresses the most fundamental health challenges for people, their families and community, as well as costing so many hundreds of millions of dollars for the health system.
I think the other thing that would be really interesting to see from this forum is if we held this again in 12 months' time and we had a real coordinated approach to some activities, is being able to get reports back about how have we moved the dial on this. You know, really have some outcomes and some feedback about what we've actually achieved and how we have shifted the dial on diabetes.
Yep, just one more question in the middle there.
So I'm Erin, I'm from Congress, and I just wanted to make the room aware, because I'm not sure if you're aware or not, based on the workforce shortage, the critical workforce shortage we've got in the territory and Australia-wide. But CDU has actually cut the nursing places for next year down to 100. The reason, and that's become not from CDU, that's come from higher up. But the reason that's come through is because interstate students are enrolled in our programs and they're behind on their placements and other things, and so CDU has been cut, which has now cut resources for our young people, whoever wants to become a nurse locally. That's, a critical option that's now not there for them because it's,
Yeah, actually that's a good point with regards to some work that PHM with a number of other agencies have been doing with the Workforce Alliance, looking at those types of activities. I think the other thing as well, around that, we're looking at different models as well for workforce so that people can work to the extent of their scope of practice and those types of activities as well, which I I really think will be worthwhile. As you know that we're quite fortunate here in the Northern Territory to have the Rural Workforce Agency aligned with the PHN as well, so they're very attuned to the needs that we have within the Territory. But there's no shying away. This isn't going to be something that changes overnight, unfortunately, but we just have to really keep our foot to the floor with regards to every opportunity that we have to be able to improve workforce opportunities. And when I was facilitating at one of the other tables, what goes hand in hand with that is if we're training people, we've got to have positions for them then to be able to work in afterwards. Otherwise, we put in a lot of investment, a lot of effort, and people become very disgruntled because there's no job for them at the end of this. So those two elements have got to run in parallel together to ensure that we can build our workforce in the NT.
That's great.
I also think, again, reflected in discussion here, there's pressure on our health workforce across the whole spectrum. You've talked about nursing. We see it in nurses working remote in primary care. There's currently heavy pressure on renal trained nurses in the top end, causing, we have increasing evidence of understanding about what underpins very rapid turnover of staff in remote, settings across the Territory. So we need to, one, think what are the strategies that will attract and retain people and support them so that there isn't that turnover. And I also loved, I think it was you, Pat, who said it, we've got to grow our own. We've got to bring together, the AMSANT academies, Bachelor, CDU, some of the pathways work, we're so putting a lot of effort into it. Menzies, grow opportunities for our local people and think as you are about new roles for people in the community. And people have talked about how challenging that is. Of course, we're often developing, patient expert roles, ways of supporting people living with chronic disease. These could all have incredible impact, but they challenge our health systems, and because we don't have a description for those roles. But again, if we can work together, build the opportunities for community members, give them roles that are recognised, paid appropriately, and give them the opportunity to develop careers and show the impact, we'll be able to advocate for that. And if we can find the solutions here and be much less reliant on people coming in, it'll be more sustainable.
Great. Thanks, Alan. I'd like to thank all of our panellists this afternoon for our very last session. I'm sure a lot of you probably had some really good key points to take away from that conversation. Collaboration, partnership is critical. Strategic approaches, the frameworks, the fact that there are so many competing challenges to get to the outcomes that we want to achieve is there and it's real. But the fact that there is an observation that there is some really strong partnerships going in the NT, along with our federal counterparts, is something that we should be really proud of in where we're going for the next steps forward. So if I can thank our panellists, please.
Can we go?
Yep. Okay, I'll pass over to Sean and Louise.
Hello. Yes, thanks Erin and the panellists for that very informative discussion and moving forward. So we really look forward to the next steps. And within the next steps, where's my team? There's a lot of work for us to do, wherever they are. The mind mapping is something that we've got to pull together, and the roadmap, and working closely with Kate Race's team in the department, or Tamsin's team, in developing and pulling all of this together, and then ensuring that all of the partners have a say and have a look and review it before we come up with the final draft. So that's some of the next steps for my team moving forward in the next couple of months. Louise, just want to...
Thank you. And from the perspective from the Diabetes Across the Life Course partnership, we hold annual educational symposiums, and they're led by our Aboriginal and Torres Strait Islander Advisory Group, as you saw yesterday, had a strong focus on lived experience and putting community voices at the centre. So we commit to continue to holding those annual symposiums, and they can be a good opportunity for coming back together in 12 months' time to check in on progress from what we've discussed today, and then potentially have another summit in a few years' time. I don't think we can do this kind of thing every year necessarily, but the symposium we can definitely do every year, and then potentially a summit maybe in 3 years, depending how we go.
And just before we wrap up, I would really like to thank the partners for bringing this all together. When we reached out, NT Health sort of led it. Louise and Dr Christine Connors were advocating for the diabetes epidemic, and I reached out and said I will support both, and Top End Health Service at the time. We took this on board, and we worked with Central Australia, and then we went out to our partners and we asked AMSANT. Thank you, AMSANT, for all your support in this and helping and guiding us. The same with the PHN. We really appreciate it. The Commonwealth, Ben, for bringing in the lived experiences across the 5 regions. So we thank you for all that support there. Kate, your team within in the Department of Health. So thank you for all of that. There is one more partner that I am missing. Menzies School of Health Research. Thank you, Menzies. Menzies has been instrumental, although I hold joint appointments, and working with Louise and her team in this to pull it all together. So, and all of you guys for your interest and support to come all the way to Alice Springs. I know people have travelled far, and the online participants, we really appreciate it, and hopefully that we can bring this moving forward, and hopefully what we've heard, we can pull it together and make sure that it's ongoing like everyone's mentioned. So on behalf of NT Health and its partners, Menzies, PHN, the Commonwealth, and the rest, we thank you very much for all your support.
I just thank a few people.
Oh, the working group. Oh, yeah.
And a final thank you to the working group for the summit. There were a lot of members on the working group from all the partners, but there were some members who really took on the greatest amount of work, and particularly thank you to Chelsea and Danielle and Norlisha and Sian and all members of the working group, but particularly those guys did the heavy lifting, and a huge thank you for their organisation.
Done. Thank you very much.